Hi, my name is Dr. Sean Boutros. I'm a plastic surgeon specializing in breast microsurgery, specifically augmentation of the breast with the All-Me augmentation. The All-Me augmentation is a novel approach to breast augmentation. Traditionally, with breast augmentation, we use one of two methods. They include implants. Implants are artificial material that's placed inside the breast. They are, however, not without their drawbacks. Implants can often undergo something called capsular contracture, where the shell that the body forms around the implants becomes hard or tight with scar tissue. People can develop breast implant illness, which is a sickness or an allergic type reaction or inflammatory type reaction against the implants. The other thing with implants are they can cause rare types of cancer, specifically implant-associated ALCL and implant-associated squamous cell cancers. These are rare risks that are associated with implants, but they are not unheard of. I try to give patients other options. Traditionally, the only other option was fat grafting. However, fat grafting leaves patients often disappointed, as a large portion of the fat will be dissolved over time. That fat is absorbed by the body and doesn't give a permanent augmentation. The All-Me augmentation used microvascular transplant of the tissue from the abdomen to the breast to augment the breast to give a permanent, long-lasting, beautiful augmentation without an implant. Talk about All-Me augmentation, we know that we're going to get a natural, soft, supple, great feeling result. How do we know that? Because we're not using anything artificial. We're only using the patient's own tissue. We shape that tissue with careful surgical technique in order to give a beautiful breast mound. However, because there's nothing artificial, it won't feel artificial. It feels natural because it is natural. It feels like you because it is you. It's an All-Me augmentation. People will often ask, what would make me a good candidate for the All-Me augmentation? Well, there are several things that would make you a good candidate. The best thing would be someone who wants both an abdominoplasty procedure and a breast augmentation. Because with the All-Me augmentation, we do an abdominoplasty in the exact same manner that it is normally done. However, instead of throwing that tissue in the trash, we augment you with that tissue that we would normally throw away. Because sometimes the best implant is the one you already have, just transplanted to a new location. Then the other good candidates for the All-Me augmentation are patients who have implant complications. These include breast implant illness or capsular contracture. Because with the All-Me augmentation, we can solve both of those problems with a zero risk of them reoccurring. The All-Me augmentation uses microvascular transplant of blood vessels, where we literally take blood vessels from your abdomen and transplant them to the chest. We get under a microscope and we repair these blood vessels that are smaller than the size of a pencil lead. And we use sutures that are finer than your hair in order to put these blood vessels together so that the blood will flow into the tissue and out of the tissue. It's a living transplant of tissue from your abdomen to your breast. The recovery from an All-Me augmentation is almost exactly that what you would expect with an abdominoplasty and a breast augmentation. Because we do no significantly major invasive procedures that are not consistent with an abdominoplasty and a breast augmentation. When we take out the blood vessels from the abdomen, we use an incision that's approximately 1.5 to 2 centimeters long. And when we approach the chest, we never remove any rib or do any invasive, painful procedures. We simply take the blood vessels, free up the ends, and suture them together so that you get a natural augmentation with your own living tissue. Traditionally, implants are the only procedure that we as plastic surgeons that have a 100% failure rate. No matter who does the surgery, if you have implants placed, it's a 100% risk of having to have surgery again if you live long enough. The reality is implants are not a lifetime device. They're not designed to last longer than 15 to 20 years. The all-of-me augmentation is different. It's designed to last forever. It lasts as long as you last, so you never have to worry about having breast surgery again. The all-of-me augmentation can be customized to fit your body types and your goals. We'll size you exactly like we would size you for an implant-based augmentation. We'll figure out whatever volume of implant or volume of augmentation you would like. We then can customize the tissue from your abdomen, assuming that it's larger than you would desire, and we can shape that tissue to give you an augmentation that's natural, feels just like you because it is you, and give you the exact volume that you want for an augmentation that's exactly what your goals are. The counseling before an augmentation begins with your initial consultation. The first thing we're going to do is look at you. We're going to figure out exactly what your goals and desires are as far as volume of augmentation and how much tissue you have to give from your abdomen. We'll then sit down with you and we'll discuss those goals so we can figure out exactly what you want will make you happy in your particular unique case. Your preoperative will be an extensive meeting with me and the nurses in order to review all the risks of surgery, what to expect and what not to expect after surgery. The surgery itself is done, and you typically stay one night in our custom overnight facilities. Afterwards, you'll go home or to a hotel, whichever you prefer. Once you're there, we'll have specific instructions and milestones that you will meet, and we will follow on a daily basis to make sure you're right on schedule of where we want you to be. I'm fortunate enough to have done hundreds of all-me augmentations. And what we've learned is that patient satisfaction is extremely high. Patients that have breast implant illness or capsular contracture are usually elated to no longer feel sick or feel a tight, stiff contraction of the breast. Patients that didn't have an augmentation are overjoyed with the volume of breast that they're able to achieve with the natural, supple feel of the breast that they're able to achieve as well. I'm so excited that you're interested in the all-me augmentation. I'm more excited to talk with you individually more about how we can achieve your goals and desires with the all-me augmentation to give you the breast and the body that you've always desired.